Hello,
Can you
good
still hear me?
morning. Yes. Hello, good morning, everyone. Good afternoon to those attending this webinar from China. Welcome to Enriching China webinar, which will discuss the topic on how to turn our communities more resilient during the COVID-19 outbreak. On this webinar, we have the pleasure of having with us Dr. Ali Cheshmehzangi from the Faculty of Science and Engineering from the University of Nottingham, Ningbo in China. He's also director of the Urban Innovation Lab and director of the Center for Sustainable Energy Technologies in that institution. Before I give the word to Professor Ali, I'd like to refer a few introduction notes about Enriching China, about our upcoming activities related to the fight against COVID-19, and also to explain to you very briefly some of the technicalities behind this webinar. Starting with this last topic, as participants of this webinar, you cannot speak out loud. Nevertheless, you are able to put questions to the speaker anytime you want in written form. To do that, you can see in the panel control of the GoToWebinar tool a menu called questions, where you can include your question to the speaker. I'm going to be collecting the questions throughout the presentation, and at the end of the speaker's intervention, I will refer to him the questions made. And actually, we already have one question there, so please feel free to ask as many questions as you would like to. So, as a second introduction note, as I was mentioning, I would like to refer a few words about Enriching China, which is the European network of research and innovation centers and hubs in China. It's an initiative supported by the European Commission under Horizon 2020, which intends to provide innovation-related services to support the internationalization and cooperation of European companies, research and innovation actors towards the Chinese market. We have a comprehensive set of services in favor of our clients, ranging from training to consultancy, including support to soft landing and so forth. Recently, we have made a substantial effort to contribute within the range of our competences to the fight against COVID-19. So we are organizing a set of webinars and other initiatives that I'm going just to refer to you in the context of this pandemic situation. Before that, just to refer the agenda of this session, we have Professor Ali Cheshmehzangi, as I mentioned, as the single speaker to discuss the resilience of cities and communities during the pandemic outbreak, a question and answer session, and then we finalize the webinar in about 1 hour. As I was referring, the set of webinars that we have in place in the upcoming days are now being presented to you. Next Monday, we have another webinar on a different topic beyond COVID-19 disease, focused on intellectual property rights importance in the context of the Greater Bay Area in China. On the 8th of April, we have a very interesting webinar which intends to present a selected offer, a selected set of Chinese medical suppliers which provide both medical equipment and medical materials for the fight against COVID-19. These Chinese medical suppliers, they are members of our network of Enriching China. So they are trustable and reliable members of our network. And the idea is that they can present their offer so that European potential customers may be interested in importing that to Europe. On the 9th of April, we're going to present an innovation challenge called ATEC regarding the promotion of solutions on technology and engineering. Then on the 15th and on the 21st of April, we have 2 additional webinars on how to soft land in China, focused on advanced technology, and the last one on the rise of artificial intelligence-driven software. These webinars, they are promoted by our soft landing zones in China. In addition to that, our website is constantly being updated about new information on on the calls open call for COVID-19, research funding calls or innovation challenges promoted both in Europe and in China. Please check our website for further information on that. And for some of those calls, we are going to launch a few webinars very soon. In addition to that, and to finalize this welcome session, we would like to invite you to subscribe to our special newsletter on COVID-19, which we are sending 2 times a week with information on research funding, open calls focused on the coronavirus, on innovation challenges regarding services and products for fighting the pandemic disease, and any other news on science, technology, innovation related to the pandemic context. So if you're interested in subscribing to this special newsletter, just send us an email at china@enrichcenters.eu to get subscribed. Here you can find our address, www.china.enrichcenters.eu, where you can find updated information from about COVID-19 and other activities implemented by Enriching China. And without further delays, I will then pass the word to Dr. Ali to make his presentation. Thank you very much for the moment. Professor Ali, you may take the lead in making the presentation. Thank you.
Okay, thank you.
I believe you are able to show your screen, Professor Ali.
Yeah, can you see my screen now?
Yes.
Yeah. Okay, then I will start. So good all from China, and good morning to all of you in the European continent or elsewhere that you may be. I trust that you can see my full screen if I'm not wrong. If not, I can minimize the site so you can see the whole. Let me just do that. Just making sure that everything is seen. Okay. So once again, I would like to thank the organizers and thanking the chair for chairing this important session. It's, I believe, one of the first that we can actually have a knowledge share between China and the EU. And we have been here, at least I have been here for the past 3 months experiencing this event from inception. And well, I think it has been quite a valuable experience, but I do believe that we are having quite a lot of issues on the way that is needs to be resolved in different parts of the world, as well as in China. So much of it is a knowledge share. I'm not a scientist. I'm an urbanist. I study cities. So I look at it from the urban perspective, and hence I would look at it from the understanding of how we can strengthen our cities through better resilience, and how we can make our communities to tackle and overcome the issues of the outbreak. So some of it are more or less related to the experience we have had in here, and I tried my best to make sure that it brings some ideas to other audience elsewhere as well. I'm not sure if the screen is moving. Yeah. So here is actually the global level and what we are doing. So I tried to picture, to summarize what has happened so far in the past few months. And coming with the first point, which is actually the official announcement of the outbreak on 20th of January. I put it a bit later because we still don't know what exactly was the first sign of the outbreak. The official records show that it has started in late December. Some unofficial reports also indicate that actually there were signs of the disease as early as 16th of November. There's still also indication that it could have been earlier than that, and we had no clue or no indication of the disease at the earlier stage. And in reality, at the time when it became quite more visible, and perhaps had more attention, and it was from the time when we see the transmission from human to human. That's exactly where this would sparkle the idea of an outbreak. And before that, it's not necessarily a case of outbreak at that point. So 20th of January, there was an official announcement, and 23rd of January, one day before the Chinese New Year holidays, starting the original epicenter, which is the city of Wuhan, in Hubei province in central China, was under a lockdown. And this was the first lockdown, which then started having impact on the provincial lockdown, a province of roughly 57 million people, and the city itself is about 11 million people. So that was that was the biggest lockdown. Unfortunately, not the biggest after that. So we have had so many other lockdowns in elsewhere in other countries as well. By the end of January, I think it was about 28th or 29th of January, more or less all provinces in China, including even places which were not expected, including Tibet, they also had cases of infected cases. And also the disease was already reached several countries. In fact, before it was announced officially, there was also a case which was traced back in Thailand. I think it was about 15th of January. So there were already signs of the spread, not beyond the boundaries of the city and the province. And it was already not only national, but actually became global. By that time, we see that the disease was already reaching places quite far from the US, all with Australia, the UK, and some European countries. And we see the spread was quite fast. And we already witnessed a rapid increase in China, South Korea, Japan, and Singapore, 4 Asian countries in the region. And this increase, especially in mid-February, was quite different to what we have had in the previous weeks. And this eventually developed into development of new epicenters, which I would say I would refer to it as the round 2 of the incident, where we do have 2 epicenters coming into place in 2 different regions. So this was quite alarming. As we see from the data, we have Iran and Italy both emerging as epicenters of the disease in 2 different regions.
Dr. Ali, sorry to interrupt you. Yes, sorry to interrupt you. The sound is a little bit weak, so I suggest we do a small change. I'll take the control over the presentation and change the slides for you to see if it can improve. Okay?
Is it any better now?
No, it gets from time to time it gets cut the sound. So let's see if we can try to improve that to our participants. I'll take over the control of the presentation. Okay, and pass the slides to you. Okay, just one second. Then I apologize for all the participants for this small inconvenience. Can you please confirm you can see my screen?
Yes, yeah.
Okay, So I think we were here, correct?
That's right. Yeah, I think we were. The next one.
Okay.
Yeah.
Just a second. Yes.
Yeah. So here we can see. Is my voice any better now?
Yes, it seems so.
Yeah. That's good. That's good. So here we see the two emerging epicenters coming into place, which are Italy and Iran in two different regions at the same time. They also, if you go to the next one, they also had an impact on the regions. Not only in the regions, but also they had a larger impact of exporting, I would say, the disease to elsewhere, even as far as New Zealand and other countries in different regions. So again, this was quite a I would say a turning point of this disease outbreak. What we see also in some of the scientific research that there are signs of possible virus mutation in the later stages as early as early March 2020. And we looked at it also, we looked at the point of view from the data perspective, and it appears so that the virus has strengthened over time, and it has actually tripled the fatality rate in some of the countries over the time. So at the beginning, the fatality rate was relatively lower in those infected countries, but this may not only be the reason, but of course there are other aspects that should be taken into consideration. But the fatality rate has at least tripled by the early March compared to what it started. So it started roughly about 2% fatality rate, and by early March it actually ended up at 6% in most countries, especially the new epicenters. And we can see eventually as the disease spread quite fast in multiple locations, I would say the unexpected places, the most unexpected places, even in Greenland, we have had cases, which is probably out of expectation, Fiji and some other countries that we're not even we didn't expect to have the disease to be reaching there so quick. But then eventually the outbreak was officially recognized and announced as a pandemic event on 11th of March 2020. And we did, as I mentioned, this reached more unexpected places, and the growth became quite different now. So the numbers increased much more rapidly compared to the initial phase. So as you can see, as you probably recall from the announcements, that it probably was one of the famous things that was announced a few weeks ago, that it took about 63 days for the disease the infected numbers to reach 100,000 people. But then it took less than 2 weeks to double that number, and it took only 4 days, less than 4 days, to reach 300,000 people. And now, as you know from the data, we've already reached over 1 million cases, and unfortunately the numbers were just suddenly jumped from 500,000 to 1 million on the just 1 week. So last week at this time we only had 500,000 cases, but now we have over 1 million cases. Again, this jump has been quite drastic in many locations. So a new epicenter is eventually emerged, which is the US in North America. And as you can see, as we are speaking today, the numbers have gone over 1 million, and we are anticipating, with unfortunately a possibility of having a new epicenter, which is likely to be in South America, and is likely to start, from my assumptions at least, and some others, it may be starting from Brazil, if not elsewhere. So what happened for us is the impact was quite tangible, and you can see this is, I put the rest into a different color as well, because we don't know how long this would take. This could be a longer pandemic if we don't have any treatments or any vaccine to be developed anytime soon. But what we have also is what I would like to share more is, as we already probably know the stories and the background, I thought we capture some of the realities and some of the important points in this event. But the important thing for us is to look at the city level aspect. And I would like to use Ningbo as a case study, as a case example, what we have done in here and what has been achieved in here. So I do recall at the very beginning of the stage of the outbreak, it was sometime around late January, that actually we started contacting the local government and noticing that most senior members of the government were still away due to Chinese New Year holidays. The city was just about to go on the lockdown. It was not yet on the lockdown. It was officially on the lockdown towards the end of January. And then by contacting them, we realized that we have to develop a more comprehensive, at least from our point of view, a more comprehensive framework and strategies that could help the city to be more resilient. So a framework was developed while I was here on 2nd of February. So it was quite fast having the first draft. And it was then sent, the full document was then sent to them on, it's not moving forward, on 10th of February. And eventually then we have had, if you go next, then we have had this strategies were implemented on 17th of February onwards. And as part of that, through this implementation, we have an enhanced control and monitoring measures, including some of the prevention measures in place. And it took about 4 to 6 weeks, I would say, that we actually managed to have all 157 cases to be treated at the city level. So on exactly 1 month ago at this time, on 3rd of March, we managed to have 0 cases, and we have continuously managed to keep that an official record to have 0 cases for the city of Ningbo. And as soon as this happened, we have had some signs of easing the lockdown measures. So those started gradually, and some of them are still in place, and we are still quite, I would say, total control of the mobility and everything else. And if you go next, yeah, and then we have in recent days, I would say that it is more like that we have entered the post-recovery phase, which is actually under some shadow of the global and national alert, because we do have numbers growing elsewhere, and we do have we are still facing the situation quite in a different way at the global level as well. So there's still this post-recovery, I would say, is undershadowed a little bit by the situation. So if you go next, so I'm going to talk mainly about a general overview of the concept of resilience and resilience thinking, and talking more on resilience enhancement. And I'd like to more focus on strategies and lessons learned. I developed 12 examples that we can look into. And I would like to finish by arguing the issues of normalization versus the new normals that may be happening or emerging from this particular event.
Okay, Professor Ali, just one small thing, sorry to interrupt again. We have some cuts in the sounds, especially when we change the slides. So I would like to ask you just to make a very brief pause of, let's say, 5 seconds when we change the slides, so that we can see if we don't have further interruptions, okay?
Okay, that's fine, yeah. So can we go to next? Yeah. So here what we are going to talk about mostly is what is resilience. Resilience comes from thinking approach, and actually it has a lot of factors that needs to be implemented into the practice of city enhancement, community enhancement. And I will touch on all these aspects as much as I can in terms of how flexible and adaptive should we, how we should deal with certain shocks, and how we then should have a target plan approach, and how we should focus on risk assessment and risk management, and how we can protect the weak spots or the vulnerable parts of the cities on our cities and societies. So if you go to the next slide, please. So here what we have is the resilience, the idea of resilient cities or resilience actually came into place long ago, but unfortunately it was mostly overtaken by the more, I would say, exciting buzzword of smart cities. They came at the same time, more or less, into practice of urbanism or urban studies. But then it was, I think, mostly smart cities that took over, because they are mostly, I think, technologically advanced. But the idea is that resilient cities, it just makes sense to us, and it's actually something which needs to be addressed from multiple perspectives. And I'm quite pleased to say that I was part of the group of scholars several years ago that we developed the first toolkit for resilient cities back in 2012, which you can see the document, the first page of the document on the corner of the left side of the screen, which was developed by Arup and Siemens. And this was a project which took us about a year, and we managed to actually develop a toolkit for resilient cities. We rarely discuss the idea of outbreak or disease outbreaks in the resilient city thinking. So even in that, at that time, we only touched on it, but we didn't really take it forward in terms of the possibility where cities should be considered for resilience aspect. But then in recent years, we have seen, especially after the cases, after the Ebola outbreak, we have seen more research coming into place 2014 onwards on the topic of resilience and coming into community resilience, and particularly during the outbreak events. So if you go next, please. The document is actually available, and you can download that document, a 60 pages document. I have provided the link, and I'm sure the slides can be shared with everyone. What we have here is what I'm going to talk about is more about the position of urban resilience. And urban resilience itself, again, is a holistic thinking, and it brings about multiple resilient systems into consideration of the overall resilience of the city and the communities. So it does include several aspects, and I think the one that we have on the screen, I think designed by some Spanish scholars several years ago, it actually is a good representation of how holistic an urban resilience should be, or where should it sit in terms of those resilient systems. And I think this is quite suitable to discuss because it sits right in the middle of all those resilient systems that we have in the practice of resilience thinking, or in conceptualization of resilience thinking. And as you can see, I just highlighted one example by another scholar, of course, that actually every single part of these resilience networks or systems are themselves having their own aspects that should be taken into consideration. As you can see, for critical infrastructures or the physical infrastructures, we do have economic values or aspects. We have civil society, we have supply chain, and we have governance as the four key aspects of how we can reach the idea, how we can maintain the resilience of the critical infrastructure. Next slide, please. So what we have here is how the resilience enhancement can come into place. And I tried to summarize it in the report earlier that there are three R's that we have to respond to consider in the resilience enhancement. It needs to have a bit of a reflectiveness, readiness, and responsiveness. And all these three should help us to develop resilience through a procedural way rather than the actual at the beginning. You can't really predict that everything to be in place at the beginning and ensuring that everything can continue in the same way towards the end of the outbreak containment and recovery. In reality, we need to be reflective all the way through, and we need to be ready all the way through, and we have to be able to respond to the outbreak progression and the requirements during the outbreak itself. So what we have is that we need to make sure that we can enhance the resilience through preparedness, and we need to make sure that we are responsive through city management. So that's something, you press next, you would see that we would have. Can you go next slide, please? Yes, we have the preparedness going to responsiveness. And what we have here is the strategies, and I try to summarize, as I mentioned, if you click next, 12 lessons that could help us to hopefully to make our resilience for cities and communities to become much stronger than what it is at the moment. And I tried to summarize that from the understanding of the diagram here from the UN Habitat only a couple of years ago, which they talked about how the whole process, in fact, if you look at it from any side, this is probably can be translated in a right way, in a different way. But what we start from left is that we start with initiation, and we have to do training, and then we have to make sure we have good knowledge of the disease and the situation. As you could see at the beginning, I think we had a different perception of the disease. But as we realize, the incubation period of this disease is actually much longer than what we expected initially. This posed quite a different situation to how we handled the disease outbreak. And that has started. So this data collection, this data gathering, this analysis, which comes later, are quite important. And of course, we need to then develop actions for resilience. And again, this becomes a process that needs to be repeated if it is needed to strengthen the resilience and, of course, take further actions where needed. Next, please. So the first lesson learned is about reflection, or to reflect in a procedural way. Being reflective is quite important. I think reflectiveness is one of the key aspects that we have to address, because not all sectors will be affected in the same way, not all groups will be affected in the same way, and perhaps also we can see that not all impacts would be the same at throughout the outbreak progression. The impacts would change gradually, and of course sometimes more drastically. But of course we have to understand that
Professor Ali? Hello, Professor Ali? I apologize to all the participants. We are having a small issue with Professor Ali's sound. Let's see if we can fix it in a couple of seconds. Apologize for that. Dear participants, I'm sorry we have a sound issue with Professor Ali. He's reconnecting to the GoToWebinar, so we will resume the presentation in about 1 or 2 minutes. Again, I apologize for that. In the meantime, just to remind you that we have the menu for questions where you can put any question to the participants. We have some questions already put in there. In addition to that, I'd like to emphasize that the presentation is going to be made available to you already during the webinar. In the panel control of GoToWebinar, you have the handout session where we are going to upload the file as soon as the presentation is finalized, and then you can download it for your personal use. Okay.
Can I check if anyone can hear me now? Hello?
Yes, Yes, we can hear you now. Please, you can continue with the presentation. Thank you.
Sure. My apologies to all participants. Sometimes technology cannot save us, as we can see. Science does, but technology doesn't. I'll continue with the suggestions, or at least the lessons learned. The second one is about all inclusiveness, which again I thought is quite important when we developed the framework few weeks.
Professor Ali, sorry, I think we lost you again.
Methods. So if you can go to the next one, please.
Yes, just for your information, Professor Ali, we lost you for a few moments, okay?
Okay.
Please go ahead. Let's see if it now works out.
Okay, I'll try my best to at least to be as loud as possible, and I hope the voice is not disrupted. The third aspect is about preparedness, which should come before responsiveness, but of course, preparedness should continue all the way through, as responsiveness should continue as well. But what is important, and that's what something we worked with the local government in here in Ningbo, was to develop a prioritization plan. So to prioritize certain aspects that should be helping to prepare the essential services and urban systems of the city. And of course, we can define those services into different categories. So we define them into 4 categories of in terms of services: basic services, secondary services, we have mobile services, and of course we have virtual services as well. And all those should be taken into consideration as part of the understanding of what needs to be prioritized and what needs to be then taken forward for the preparation of the city. Next, please. The fourth aspect is about, and what we've seen in here was really effective, what we have seen in other Asian countries as well has been really effective, is about the monitoring of the precautionary measures and compliances. This requires collective compliance, as we can see elsewhere now, but I think it is important to make sure that we actually monitor those measures on a regular basis, and we should make sure they are continuously monitored, continuously adapted if it is needed, and enhanced in particular occasions. Again, that monitoring is really important. And I can give you an example of how still, education is not yet back into full operations in Ningbo. But what we have is that every entry and exit of anyone coming to the campus is not only monitored, but it's also pre-recorded. So if a person wants to enter the campus, if it is even a staff living outside the campus wanting to enter the campus, they have to get approval from 3 levels: from the line manager, from the HR, and also from the university level office, which shows that how the monitoring has been taken into full consideration at this time of this incident, even that we are more or less in the post-recovery phase. Next, please. The fifth aspect, which is quite common in most of the scholarly work and a lot of research studies, is about bringing back people. So it's important to gain trust and have more support from the communities, from people that are key actors, and they have to be taken into the decision-making procedures as well. We have to make sure that this is a good opportunity to develop new partnerships. We can have community representatives involved and respond to the community needs, and also helping the opportunity through different media to have opportunities to establish private-public partnerships, as well as addressing the issues of local economies. So again, people dimension is quite important, and they could play a big part in actually developing the resilience. Next, please. And it is important for us to note, at the end of that previous slide, that governance is actually not only government. So the governance do have different actors, and people are actually part of that governance as part of the actors of that governance. Next, please. One of the important aspects for us, coming at least from the planning perspective, is about how we can bring or how we can encourage and develop adaptation and adaptive planning. So this requires to be through adaptive thinking, which is essential for better city management. As we have seen in Ningbo and some other cities, we had to adapt some of the new strategies. We have to adapt in terms of different operations. So we have to consider adaptive measures, adaptive operations, adaptive management, and adaptive planning. And that was something which we've seen quite a lot at the city level in here. This requires actually a different thinking than the regular business as usual practices. So I do believe that business as usual practices can only work at the time when we do have business as usual situation. We are not dealing with an ordinary condition or situation. Hence, the idea of a business as usual practice may not be really effective. So we may end up wasting time and efforts, as we have seen in many occasions. I can give you an example, which it's not a big critical aspect, but I think I have to mention as an example. But it was only about a week ago when the UK government mentioned that they would like to send letters to everyone with leaflet, and it cost £5 million to do so. And that means reaching 30 million households across the country, which I do believe at this point of preparation needs to be enhanced, and responsiveness should take over more strongly. I do believe that type of approach, of a business as usual approach, is not really effective. It's rather late to actually send leaflets at the cost of 5.8 million to people, to all households. I think that would be a waste of efforts, and unfortunately wouldn't be so impactful. So again, it's important to really look at it from a different perspective and not really follow the business as usuals. And that requires a bit of planning, and that requires a bit of adaptive thinking, of course. Next, please. One thing which we've seen quite a lot in here and elsewhere is the increase in the voluntary support. So it helps in multiple perspectives, and as we have seen, other examples of other countries where, when they called for voluntary services in the UK, National Health Services, there were also quite a good number of people actually volunteering.
I think
Hello?
Yes, please go ahead. There was a momentaneous cut in the
yes, it's actually noted. Sorry about that.
Yeah.
So what we have is this opportunity for voluntary support or actually from the communities to be put in place at the community level, which again is quite important. And that's something we've seen in Ningbo, and it was really successful as an approach. I can give you an example that several weeks ago, when I was studying some of the access points and some of the areas that were of concern to the government, and we had to go to several parts outside in the rural areas of the city, so outer skirts of the city in Ningbo. And interestingly, the local communities were officially given the authorial role that they could actually, they didn't allow us into any of those villages. Interestingly, that this was centrally managed, but at the same time, we had volunteers on the ground from those residents that they were actually taking shifts, and they were taking care of the community mobility and people going in and out of that community. Not only that, but several other villages that we had to study and record as part of our studies a few weeks ago. Next, please. One thing which is of my interest perhaps, and I think what I've seen as a positive aspect, is about how we impose regional level strategies. I always trust that the national level guidelines are really useful, but to implement them, you can't really narrow it down from national level all the way to the city or the community level. So there has to be some sort of a transition of some sort, or which requires to be happening at a smaller scale of regional level. So one thing which has been quite successful in China is that we do have national level guidelines, and as we have seen elsewhere as well. But then we have the regional, which is at the provincial level in here. So this has been regional, let's say, adaptation of those guidelines and turning them into strategies. So they then become implemented in the form of strategies at a much smaller scale. This allows us to actually help to nurture these regional level strategies, and of course, helping the local governments to have a higher responsibility. I say this is quite important because we don't expect the disease to spread in the same way across the country. So as you can see, in some parts, like in Germany, we can see the south of Germany has been more affected. Three parts of the country have been more affected than elsewhere. So those regions have to have more. They have to have much enhanced measures that compared to other parts, perhaps. And similarly, we can see that in Italy, this has been, for example, at the northern part of the country, has been more significant at the beginning. If we actually implemented regional level strategies from inception, we could have at least controlled, or at least narrowed down the scale of the transmission to some extent. Unfortunately, mobility is one of the aspects which has not been controlled globally, but then that's what I would probably address in one of the later slides as well. Next, please. So this comes to the idea of how then we can enhance control and monitoring at the community level. So again, for us is more like a community level, but I think in the European countries it is more about considering this at the district level when it comes to cities. So we have to have certain adaptive measures that should be implemented at the community level. Those are the place, that level is the level we actually implement, and we can manage the details and aspects that are related to the community vulnerabilities, such as we can have, and I suggested to Ningbo government several weeks ago. Luckily, we only had 157 cases at our peak, and we never reached the level of needing the designated treatment areas. I suggested that we should have, at that time, at the very earliest stage, I suggested we should have community level treatment centers rather than populating our hospitals, which actually can have a much adverse impact on our health systems or healthcare services. But as time passed, and as the enhancement of the resilience was in place in Ningbo, then they designated 15 hospitals in Ningbo and in the surrounding areas. So again, they designated some specific hospitals which they could actually accept patients, not allowing patients to flow between all these particular from different hospitals or clinics. At that time, clinics were closed, and which was actually advisory to do so, mainly because clinics and the smaller healthcare services, they are quite vulnerable, as they may not have enough security or control or monitoring services in place. And as part of that, they are likely to get infected themselves, as we have seen elsewhere as well. So that was something which put it I think it was 3 or 4 weeks of temporary closure of all clinics in Ningbo, which was quite effective. So we not only centralized, but we have, what happened in Ningbo was that the patients were then allocated in certain parts. Each district in here had 1 or 2 hospitals dealing with the disease specifically. And this was also similar in the rural areas, outer skirts as well. Again, this is quite important, not only from the health services point of view, but also from the food supplies and distribution. Often most of the research on food supplies in the outbreaks are looking into safety aspects, but in reality, we do have other aspects which we have highlighted in Ningbo, at least in our framework, that we have to take into full consideration 3 very important aspects of availability of food supplies, and as well as distribution of the food supply, and as well as the accessibility of the food supplies. So we do have a lot of vulnerable people, that may be not, they may have less accessibility to food supplies. And again, if we don't look at it from the smaller perspective or smaller scale, we may not have a good perspective of those vulnerable groups. And of course, this also relates to our social services and how social services, rather than to be centralized, my suggestion to the Ningbo government was to make sure they are kept at district level, if not anything lower. Okay, next, please. One of the important aspects, I would say, is about how we control mobility and transportation. As we can see that most research actually looking into transportation as the first cause or the most important cause of the primary cause of the transmission, the speed of transmission. And as we can see, as we are really connected, living in a very connected world, it only took a few days for us to actually for the disease to reach the quite far, very, very far places. So we have seen the example that why the US is facing quite a lot of issues of rapid increase at the moment is partly because of the lack of control on mobility and transportation. Not criticizing individual countries, but this is something that we already know, and we have to make sure that if any measures are in place, I think it should be the transportation should be prioritized as early as possible. And this happened in Ningbo. In Ningbo, transportation was very limited in the first few weeks, which was an alert point until we actually managed to get into a safe zone, I would say. So the city really put control on transportation. Of course, private transportation is relatively much safer, but public transportation was completely stopped. So that was quite important to make sure that other methods of transportation, other modes of transportation are replaced. For example, using bikes or cars are more advisory than actually using public services. And in reality, the in and out of communities here is much easier to be managed, but I think there's again a chance for us to have temporary measures to control and monitor the in and out of communities and places or public areas. And again, this was quite important for us to make sure that we narrowed down the containment procedure in here, which was quite effective in many ways, where we actually, the whole city was under full monitor of in and out of people through the mobilities. Next, please. One thing which we have to bear in mind, which is really important, which will stay with us much longer than the disease itself, will be the economic crisis or the economic impacts. And in reality, this is something that has affected every single country, even those that are not having any cases, directly or indirectly, they would have economic impacts. And one of the things that we have to address, and we have talked about it, about this particular aspect with the local authorities from the beginning, is to ensure having enough support for small and medium-sized enterprises. And those are the ones are expected to be affected the most in terms of the economic impacts. And we do believe that the governments, if possible at the local level or national level, they should provide tailor-made legislations or legislation that could actually support them to make sure that this is a temporary matter, but then there's little, I would say, the smaller and medium-sized enterprises or businesses would be affected the most, even in such a short time. So we would anticipate much higher number of closures, permanent closures in those businesses if we don't have right legislation in place. Next, please. Last but not least, I would suggest that paying attention to details is quite important. This doesn't mean that we should avoid the generalities, but we should then understand and practice the details, which are quite important. So one of the most important aspects that should be taken into consideration is to keep the essential workforces safe. And this has been addressed in many scholarly work on outbreak progression or outbreak events, that keeping the essential workforces safe is one of the primary things that should happen. Keeping the food supplies healthy and available is quite important. Utilizing the media as a mean of education training is quite important. Improving the hygiene in multiple ways is quite important. And again, those are the details. I do believe that at a larger level, it may not be so effective, but we have to pay attention to the details at a smaller scale of cities and communities. And again, what we can see that what we have done, at least I would say a very micro level of where we are at our campus, we have seen tremendous amount of changes in terms of how the practice of hygiene and let's say the raising the awareness has changed over these few weeks. We started with only once a day disinfection of key areas, for example, lobbies or lifts. And when we realized that, okay, we do have one daily disinfection procedure, but this may not be effective when we have more people on campus. And this has changed to 3 times a day disinfection procedure. So it happens in the morning, midday, and after the closure of the business hours. It shows that actually we have to look into things at a micro level, and those details can only be attended at the smaller scale. And again, this requires to be implemented at the smaller scale of cities and communities. And I don't think that's feasible to happen at the national level. And again, as what we can see, national level are generally guidelines, and the implementation cannot happen on that scale unless we are dealing with a country which is a small, let's say, such as Singapore or Monaco or San Marino. If we are not a small country, then it is not really feasible to implement the national guidelines directly to cities and societies. We have to make sure we find a way of how they can be then implemented in the form of strategies. Next, please. I'd like to address some of the normalization versus the new normals. The first one I would say that you are quite familiar with is the contactless system. So the contactless, I would suggest, I do believe that this is going to last for longer, and of course to be enhanced even further. What we have is 2 different modes of contactless. There's an emerging contactless method that is emerging in here, at least, that and also we have seen elsewhere, that we don't need to be in direct contact with the person who delivered the food or the goods. So we have now designated spaces. We have now designated spaces that actually the food is placed, and then after several minutes you can go and then collect the food from an entrance or even sometimes outdoor areas. And this has been quite a common practice. The other aspect, I would say that this would become, rather than normalization, this becomes a new norm or new normal. Then it becomes the enhanced hygiene in various places. As you can see, a simple thing in here, where we do have some colleagues returning from elsewhere, and now they are just about to finish the quarantine time on their households. We do have also people visiting them on a regular basis, giving them food and checking their temperature. But at the same time, all those blocks or on the compounds are all disinfected in a more enhanced way. And we do see an example that we have a sellotape is added to the lift. Not only that it can be removed and replaced, but also due to the number of disinfection procedures that are taking place, it doesn't also damage the lift buttons. So again, that type of detail, I do believe that comes into the future procedures more and more. Next, please. And what we have seen is also that the awareness is increased quite a lot. Somehow, I think I would say it is quite positive, because now people believe more into more about the scientific matters, which is quite important. But at the same time, we have seen that there are quite a lot of procedures that shockingly we didn't follow as much as we should. And some of those we have seen in different forms. So we have in here a card which was actually given to us by the faculty. It's a small card which was given to all the staff. At least they were placing them in the offices, where we can see that there's we have to make sure that certain procedures should be reflected, should be followed. Next, please. And we have seen quite a lot of one aspect which I think is quite important was the checking the temperatures and checking the health conditions of those people going in and out of places. Even back in several weeks ago, I recall friends were saying that people entering in Schiphol Airport in Amsterdam, there were little procedures of checking people, and this was also reported 2 days ago on a news item in Heathrow Airport. Again, I think we are still a bit far behind checking our health check procedures in many countries, and I think it's important for us to make sure this is done properly, and this may become a new norm in many airports, as we already, if you have traveled through airports in Singapore, in Hong Kong, in Shanghai, you normally see that in those airports, and even in Tokyo or Osaka, you would see those type of procedures are already in place for several years, especially after the incident, after the MERS outbreak. And SARS and MERS, both of them, I think they put an impact on those procedures to be in place. But I think we would see that this becomes a more probably more popular way of doing the checks on airports, not only airports, but also in major transportation hubs or major hubs that people would populated areas. As we have seen in here, I give you a few examples that how this has become a new norm for us. That even I think it was a couple of weeks ago, we ordered food from Pizza Hut, and believe it or not, the delivery came with a paper on it, and the paper indicated and signed officially, apparently, and I have it here. I can share it with you later. It was signed by the two people who have been working and packaging the food and also delivering the food and checking their temperature. So that level of detail is something which is quite important. And again, it may stay with us for longer than what we expect. Next, please. So yes, one of the things which is quite important is the use of facial masks. So next, I would suggest, okay, using that type of facial mask is important if you are indoors, but if you are outdoors, using the other facial mask is also important. Unfortunately, for several weeks, we've seen examples of not using or not recommending the use of facial masks by many countries, but only a couple of days ago when a paper was published, scientific paper was published, I think some countries are now making this to become compulsory. So we have 3 countries starting, I think Austria, the Czech Republic, and Slovakia, they have actually made the use of wearing the facial masks, medical facial masks, compulsory in public areas. This is again something which we've been talking to colleagues and friends a few weeks ago, that we were shocked that this has not been yet implemented as such. Importantly, if you look at it, I think this is also a cultural factor. If you look into the Japanese culture, this is quite visible that they already have been using the masks for a long time. And the idea is not about not to catch the disease, it's about not to pass the disease to others. I think that's the other way around that we should look at it. And in reality, by wearing masks, especially that we are dealing with the disease, that we would have very little information about symptoms or very little signs of symptoms for 14 days, up to 14 days. Then having a facial mask is not about just protecting ourselves, it's about protecting others in case that we may have the disease in our body. The second aspect in the middle is about how we are dealing with increasing poverty globally. And as a result of that, we may need to start looking at how the governments can actually support and how this would last quite long. Unfortunately, this becomes quite a norm, and this would pressure our social services. The other new norms, if you click, there are 2 aspects together, is about how our postal services may change and our police, or at least our community, I would say, safety and security services may have a much powerful position. I mean, in both ways, I think this would be it should be a change for us, and I think it's important that we give priority to the safety and security services in the cities, and as well as that we would have changes in how we can use more digital users as we are having now. We don't have to attend a particular event in person. We are here online with 40 plus people. This is likely to happen, and this would have impact on other services, including postal services. Hopefully, I would say that this would have an impact on less postal services in other parts of the world. As we have in China, we rarely receive letters on certain occasions only. Next, please. I think this is probably the last slide. That we are, of course, dealing with the emergency situation at the global level, and also the crisis are seen at the national and sub-regional level. But I think it is important not to let that crisis to come into cities. I think what we can do at the city level and the community level is more.
Professor Ali, I think we lost you again. Please confirm you can hear us. Yes, I think as we were really approaching the last slides of the presentation, while Professor Ali tries to reconnect or to regain the audio, I'm going just to so I think we can finalize already the presentation. Professor Ali, if you can try to rejoin the webinar just for the question and answers session, we would really appreciate. In the meantime, in 30 seconds, I'm going to put the presentation on the handouts menu so that you can already download. Dr. Ali, whenever you are back, please let us know. Just let's wait for 30 seconds so that we can start again. Yes.
Hello? Okay.
Hello, Dr. Okay.
I had to rejoin. Okay. So
okay.
yes, I
Good.
think it is important to make sure our resilience is more is actually nurtured as much as possible at the city level and at the community level. Those are the scales we do believe that things can actually be implemented much faster and more effective. And I'm happy to take questions, hopefully not so scientific. I'm not a scientist, but I'll try to address anything that actually comes under my expertise or my area of research. Thank you again. Thank you all. My apologies for disconnecting several times.
Thank you very much again, Dr. Ali, for the very comprehensive and deep presentation on all these aspects related to COVID-19, which are not directly healthy related, but also very important ones. I'm going to refer the questions to you, and then you can answer all of them all together as you wish. Okay. So a first question was, what are the first lessons learned to improve social resilience? I believe this is referring, of course, to the case of China. There is another question, which I believe has already been somehow answered during the presentation, but it says that theoretically it's interesting, but in the case of an emergency, as with COVID-19, how to act on a city level. There is also one question, I don't know if I got it correctly. It says strategies at regional level. What about guidelines at national level? I believe the question is about whether there should be some sort of orientation still at national level. Another question. So having community treatment facilities is the lessons learned instead of overcrowding hospitals. And the final, another one is if new co-creation and co-production initiatives with citizens have emerged. I'll now pass the word to Dr. Ali. In any case, if any other participant would like to still put a question, you still have time to do it. Professor Ali, please go ahead.
Sure. Yeah, can you hear me? First to check that. Hello?
Yes, perfectly.
That's good. Okay, so I'll answer the questions one by one. So the social resilience and how it was achieved. Well, I do believe that the important part of social resilience comes from media. And I think what has happened, we do have a very much controlled media in here. But in general, I think the media also took a very good turning point in terms of how they were quite transparent in the data. They reduced uncertainties as much as possible, which was really important because we deal with we still deal with uncertainties in here. But to reduce the level of uncertainties helped a lot for people to actually understand the situation more. And the compliance here was so excellent. I would say that very collective and very excellent. But in reality, what we had is that the social resilience came into, it was a collective matter. I think one of the aspects that is more effective in China than is also, from my point of view, is about how cities are planned. In a way that the fact that we have cities are gated communities, I always thought it's not really positive thing, but in this incident, in this occasion, it actually turned out to be a very positive thing, because it turned those communities or those gated communities in a much stronger community together. So there were a lot of support at that level, that actually one neighbor could have helped the other. So again, these are quite important. And also it enabled people to come together to resolve the issues more collectively rather than individually. So again, that collective approach rather than individual approach was quite important. And then to enhance the society, we really come out of that individual thinking as much as possible. Unfortunately, I have to phrase what Margaret Thatcher said in 1987, which she said really nicely in a way, that we are not a society, we are just individuals. And I hope we are not, but I think this incident can actually help us to come out of that individualism and come to help to the social resilience is not an individual based, it's actually based on a group of people coming together. The second question is how we should act. I think at the city level, I think more or less this was answered throughout the recommendations. But the important thing is about how it should be. My key message at the beginning to the Ningbo government, and now is about how we should be all inclusive and how we should be responsive to the situation. As the situation changes, it can be changing drastically or gradually, but we have to make sure we respond to them properly. And also through all inclusiveness approach, not leaving any sectors or any urban systems behind, we are able to act more promptly in a way. The question on the guidelines at the national level, we shouldn't neglect, of course, those guidelines, but we have to bear in mind that those are guidelines, and to implement them, they have to turn into strategies. And those strategies, I would suggest that they should be strengthened, and those guidelines then are the directing points. And of course, that should all continuously happen. But when it comes to implementation, the local governments or the regional governments should take a stronger position and enhance those guidelines into the form of strategies and implement them into the actual practice of resilience development. And the suggestion about not overcrowding hospitals, I'm not sure if I got the question right, but the comments, well, I don't think that many cities would have so many hospitals. We do have a lot of hospitals in here, but Ningbo is a big city with its surrounding areas. It's roughly about 7 million, if I'm not wrong. 6.5 million people in the urban area, so we do have quite a lot of hospitals, but not all cities do have a lot of hospitals. So if we don't have too many hospitals in the smaller cities, then the suggestion is to not have those hospitals to be the treatment points. They can be areas designated in the surrounding areas or close to the hospitals, but having them to be mixing with the already other patients. We have to bear in mind the world may seem to be stopped somehow, but in fact, we have a lot of other things happening at the same time. The other things are still continuing. We have patients that are going for cancer treatment. We have patients going for other treatments, and those are the ones we have to keep safe. And by mixing the patients and not having a monitoring on the procedures, you are putting also a big pressure on a possibility of having infected workforces, and that's actually quite risky. So the idea, and luckily we didn't reach that level in Ningbo, as I mentioned earlier, but the idea is that we could actually allocate community level or district level locations where the patients can go to, so they are not all going into populated hospitals. So my idea of decentralizing the healthcare services at the city level was something which again happened partially because then we had 15 hospitals where they were allocated for receive, or they were designated to receive patients across the city. And the final question on co-creation with the citizens, yes, it did happen. I think one of the important things which was quite visible for us is about how the community representatives and volunteers were part of the whole procedure of control and monitoring and prevention measures. and they were the actual people on the ground. You know, that is something that needs to be taken into consideration. I don't think we can have police or security in every corner, and I don't think any city has that many police forces or security forces. So it's important that how the community actually played a big part in making that to support the city's prevention and monitoring measures. So any more questions? I hope I answered the questions, but if there's anything further, I'm more than happy to discuss later as well.
Thank you, Dr. Ali. Indeed, we have a final question. Just before I mention that to you, to remind the participants that the presentation is already uploaded in the handouts menu, and you can download for your use. The final question is, there was not much reference to digital space or internet services, and the question is if you think there will be more emphasis on online educational and entertainment in the years to come, especially related, for example, to schooling or distance learning.
Okay, I thought since this is quite the usual suspect, I thought I wouldn't include it, but yes, indeed, we would have. I would say that actually I was writing about this 3 weeks ago when I was passing the additional report on this topic, that we do have quite a lot of. This has become a good opportunity for many digital platforms and digital technologies to take over some of our conventional methods. In what we have seen in here in Ningbo, that this is, I think, our 4th or 5th weeks of the online education completing. So we have gone completely online, as elsewhere has also done so. And of course, schools have done the same as well. And we do see an opportunity for a good opportunity. In fact, that's a probably positive thing that we do have for distance learning and online education in particular. But we would see also the new normals also would include more online shopping methods. E-commerce would, of course, become, as already we have seen, Amazon has had a really good time at the moment. They are actually recruiting more staff in this particular time. But we would see the emergence of e-commerce and also other digital technologies. Some they would come in the name of security, I would say, like facial detection, or there would be the other uses that they would become more commonly used. But then they become the new norms. Believe it or not, in the next few years, we would see them more common, of course. And again, for internet services, we are not. This is a completely different time than, let's say, 20 years ago. So some scholars are already talked about the differences between the time the disease has happened and the time, for example, SARS happened. And we are in a much connected world. We do have a lot of systems that were not in place, or technologies that were not in place back then. So again, this is an upper hand for us to take an advantage and actually try to think about how we can be more connected. Socially, we have been connected. I'm always dubious about social media because it can be good and it can be bad. But the positive part of social media is that it enables us to be connected with our families and friends elsewhere, at the time of the lockdown measures. But also entertainment is much stronger than, let's say, much better than, of course, several years ago, where we have a much extended platform of entertainment on internet services. And again, these are the things we would see that they become even more popular and they become more common in the next few years. And one of the things I would say, as I mentioned earlier, is going to be, we have seen in here and we have seen elsewhere, is the popularity of online shopping, which has already been popular in China, but I think this would become even more popular after this event. I hope I answered the question, but I'm more than happy to answer any other questions if there is any more.
Thank you, Professor Dr. Ali. I think all the questions have been fully replied. We have no additional questions. So I'd like to first start by thank you, Dr. Ali, for the presentation, for being available for this webinar. The University of Nottingham Ningbo has been a long-standing partner of ENRICH in China, and has helped us in implementing this webinar. Thank you as well for all the participants for attending the webinar. As I said at the beginning, please stay tuned in our website for further news on research and innovation opportunities and relevant information related to the fight against COVID-19. We have upcoming webinars. We have a special newsletter on the fight against the pandemic, if you wish to subscribe to it. Please be safe in the upcoming days and weeks. Thank you very much, and have a nice day for those in Europe and a nice evening for those in China. Thank you very much.
Thank you. Thank you. Goodbye.